Good afternoon, everyone. Thank you for joining us. This is the weekly media briefing and public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Hispanic Public Information Officer, and joining us today, our very special guest is U.S. Representative April McLean Delaney. Mr. County Executive, it has been a very busy morning, but the floor is yours. Go ahead.
Sure. Oh, go, Mark. Yeah. Here.
So thank you, everybody, for joining us. We certainly did have an interesting morning. We were just conducting a meeting briefing outside today from the Sidney Kramer Regional Service Center. And we're here because Representative April McLean Delaney organized a visit from the Congressional Women's Democratic Caucus to this facility. And first, I want to thank Representative April McLean Delaney for her leadership and our entire Montgomery County delegation, Chris Van Hollen, Senator Angela Alsobrooke, Congressman Jamie Raskin, and Congressman Glenn Ivey. They're all standing up for residents who rely on affordable health care and a functioning federal government. I also appreciate the Women's Democratic Caucus and the members of Congress who visit us today to see how we connect people to health and human services, income supports, and public health programs. Their visit matters because it shows what's at stake for the families we serve. And I really appreciate the effort to put a human face on this, because this isn't just about a debate between Democrats and Republicans. It's really a debate about what happens to people in this country, who wins and who loses from the federal shutdown and from the big, bad, horrible bill that Congress is going to be debating in Congress. This morning, there's a lot of finger pointing across aisles as to who's to blame for the shutdown. But I want to be clear, just like the last shutdown, this president and congressional Republicans, they own this. They control the White House, the Senate, the House of Representatives. If they can't pass a budget, it's on them. And the fact that they refuse to negotiate or consider anything coming from the Democratic side of the aisle pretty much makes it impossible to negotiate. So when you get yourself in a situation where you can't even pass your own budget, you have a serious problem. And we could have worked our way through this, and that's not what happened. At the epicenter of this shutdown is healthcare. And the idea that the healthcare is the epicenter of any kind of shutdown is really a sad commentary. It's about the costs and premiums that people are going to have to pay while others are going to wind up losing their healthcare. The Trump agenda would dismantle key parts of the Affordable Care Act, kick people off of coverage, and raise premiums for everyone else on the exchanges. Deep Medicaid cuts are going to harm hospitals already operating on thin margins and make it difficult for healthcare providers to cover costs. Those choices don't make care better or cheaper. This is not an efficiency drive. This is a destruction drive. They push costs on to families, counties, and providers. And thousands of Montgomery County residents are going to feel it in their budgets and in their doctor's offices. I'm not sure that people fully understand that unless Congress restores at least some of the funding that was cut from the big bad bill, we're facing the same possibility of job loss. When President Trump talked about laying off everybody who wasn't funded after October 1st, that kind of was a clue to what they're really doing. Those jobs aren't going to exist in the new budget. All he's doing is cutting all the jobs in his dream that he would have cut anyway. And that's really a problematic thing. He's threatening to cut jobs if the budget isn't passed, but passing this budget will not eliminate the massive job losses that the president's budget carries with it. And those job losses are going to affect the ability of departments to operate. It's going to cut funding to NIH. It cuts funding for healthcare subsidies. It cuts Medicare and more. Democratic leader Hakeem Jeffries said it pretty well. Our position's a simple one. Cancel the cuts, lower the costs, save healthcare. That's what this fight is about. We're here, we're able to find a bipartisan path forward to fund the government. That's what this fight is about. And if you think about it, if they go through with the tax cuts, you can see the people who are going to get hurt. If the Republicans don't get as big a tax cuts as they were counting on for the billionaire friends, show me the billionaire that's going to be harmed by not getting a bigger tax cut. Tell me what level of suffering, what medical care, what health care, what lack of housing they'll be forced to endure if they don't get a tax cut. Compare that to what happens to people if they do get a tax cut. What they're doing is unconscionable. The economic impact is real. Tens of thousands of county residents are tied to federal workforce as employees, contractors, and vendors. We have about 78,000 federal jobs in the county and about 48,000 are county residents. Healthcare costs are going to go up for people in the individual market, and many will lose their health insurance altogether. And it's just not right. At the beginning of this year, before Trump and DOGE decimated the federal workforce, there were 77,550 federal employees. It's a massive part of our economy. And the loss of jobs, whether it's 10,000 jobs or 40,000 jobs, is going to be significant for the county government and our budgets. And our budgets are about people at the end of the day. We don't tax people and raise this money just to raise money. It goes into programs, whether it's schools, transportation, healthcare, police and fire, all these services that we participate in and that we fund are where this money goes. And it's a problem when this is gone. This is the difference between the last shutdown and what we face now. Last time, it was a hardship, but people bridged the gap because they knew the jobs were coming back. This time, if the jobs are eliminated in the budget, they may not bridge back to normal. Next Wednesday, we're going to have a press conference for the new opening of our mobilized Montgomery Federal Workforce Center at the WorkSource Montgomery offices in Wheaton. We invested an extra $700,000 toward WorkSource Montgomery in FY26 in order to build additional capacity to serve displaced federal workers, contractors, and vendors. We saw that was coming, and I appreciate the hard work and quick action of the WorkForce Montgomery team to get this expansion ready and open so quickly. I encourage all of you to please cover that event next week. Of course, we're not going to be able to help all of the affected workers, but we're going to do everything we can to help as many of them as we can. And speaking of our budget, we're fortunate that we've managed our county budget and finances with prudence and caution. We ended last year with a surplus again, and we've not spent into it because we anticipated turbulence that we know is coming with us. If federal support is pulled from Head Start, for example, we will look at backfilling critical programs for young children. If homelessness funds are cut, we will act to prevent more people from ending up on the street. That likely means tapping reserves in the short term, but reserves are finite, and if household incomes fall across the region, our revenues are likely to fall as well. And that's something we're going to have to deal with in the next budget when we start that work in the spring. And that forces choices on us on curtailing things that we need to do. I also want to focus on who this is about. Here at the Young County Service Center, there are residents getting dental care, new parents getting health coverage for baby workers between jobs, immigrants and refugees, residents with disabilities, and small business owners caring for loved ones while keeping the lights on. You'll find people like this in facilities like ours in every state. You'll find them in red states and blue states, Democrats and Republicans. Healthcare is nonpartisan. Dignity is nonpartisan. When you can't put your loved one into an adult daycare center, it's not going to care whether it's a Republican elderly person or a Democratic elderly person. It's going to be a major impact for the people who are affected by this. There are residents here getting dental care. There are new parents who are getting health coverage for their babies. And all of this is nonpartisan. During the last shutdown, the community shut up for one another. Neighbors checked out neighbors. People donated to food pantries. Nonprofits rallied to support families connected to the federal workforce. If this drags on, I expect Montgomery County will again demonstrate that culture of compassion. County government will keep service counters open, share accurate information, and help people navigate a tough moment. I also want to thank there were many restaurants in Montgomery County that provided meals for people who did not have incomes during this period of time. Montgomery County represents the best of this country. It's diverse, inclusive, and humane. I know that vision is often attacked by Trump and the MAGA movement, but we're not backing away. We'll keep fighting for affordable health care, for hospitals and nursing homes that can stay open, and for a safety net that actually catches people when they fall. I'm going to turn it over now to Congresswoman McLean Delaney for her remarks. Again, thank you so much for organizing this event and inviting me to join you in this and to highlight the work that's being done by our staff and highlight the people who need these services. Thank you.
So, Mark Elrich, you care about your county, and people know that, and you stand up for your county. And it was, yes, we are here because of this terrible shutdown, which started about 14 hours ago. But in essence, it is about so much more that has happened over the past 9 months, and what is happening in a way which makes no sense. As many of you know, I campaigned on common sense, common ground, and I've been desperately trying to find it over the past 9 months. But, you know, we need to have solutions and not to play political games. And it's something that's really important. I started this morning actually on the Capitol steps in Annapolis, and then went in and had a press conference with our governor, our lieutenant governor, our controller, but a lot of the Maryland federal delegation, just to really talk about the cuts and the need for us on, you know, county, municipal, state, and federal levels as Democrats, but as Americans, to really stand up against the shutdown, but also the whole Republican and GOP administration assault really on how our agencies are funded, how the priorities of who we are as Americans. And I often say when I go into, you know, I have a very, very diverse district. If you know the 6th district of Maryland, starts in Up County, Montgomery County, but also includes all of, you know, Washington, Allegheny, Garrett, and Frederick. And when you think about that, it's probably one of the most diverse places economically, socially, and politically. But, you know, no matter what party, Republican, Democrat, Independent, I always say I have their back. I represent all 900,000 residents, and my first priority is the health and well-being of every single person I represent. Man, woman, child, whoever it is, you know, if they're in my district, I will have their back, and I will stand up for FEMA funding. I will stand up, you know, for the 35,000 government workers that, you know, work at NIST and parts of NIH and the Institute on Cancer and Fort Detrick and our fire academy, and stand up for so many of these incredible cuts that have happened that really did not have to happen. Even for our farmers, I must tell you, I'm a farmer's daughter. I met with all 5 farm bureaus, and, you know, they're steaming mad about cuts to R&D at USDA because they've got, you know, all sorts of, you know, pesticides they want to research. They're upset about the tariffs and their impact on their ability to sell crops, and on immigration and the ability to have people help them. So there's a whole host of things that have been driving what's happening. But I guess I would have to say that no one wants a shutdown. No one wants a shutdown. I don't want a shutdown. No one wants a shutdown. It costs more to have a shutdown than to keep the government open. And those that are most impacted are, you know, hardworking communities, but most especially our dedicated civil servants who show up every day in a nonpartisan way to lift up, you know, the health and well-being of who we are. But nonetheless, we have to stand up to an administration and a GOP who demands to get what they want, no matter what, in priorities and budgets, and without any dialogue from our side of the aisle. And the most important part, and what Mark referenced, is really, you know, we need to cancel a lot of these cuts that have been rolled out, which are draconian and are impacting us. We need to figure out ways in which we can protect our healthcare, because it is really not alarmist. And so many people are saying, this is really alarmist, April. We don't, what's going on? But if you think about it, in my district, 1 in 7 families are on Medicaid, and 1 in 3 are children on CHIP. Many of our rural hospitals in Allegheny and Garrett and Washington and clinics are either going to have to shutter or, cut essential services. And our these premiums on average in my district are projected to go up over 90%. So when you think of, and ironically, it's a greater percentage the less money you make. So when you look at this cumulatively, it is really horrific. But my colleagues across the aisle say this is alarmist. This is not happening. These cuts to SNAP really are not going to impact children. Well, they are. And so I'm asking everyone to share their story, share their narrative, share their impact, so I can then lift that up, because I think that's what we have as a national narrative. But also how we highlight the fact that, in this shutdown, we really do care, that we really do want to help mitigate, and that we will show up and be there while we try and negotiate, hopefully to keep this, to reopen this government, but also to reopen a dialogue so that we can be able to really protect the well-being of our country. The last thing I'll say is, I'm so glad, even though I am born and raised in Idaho, and I do love my Idaho, I'm so glad that I live in Maryland and in Montgomery County. Gaithersburg, they say, is the second most diverse city in the country based on population, but it is an inclusive, bright place that is so unbelievable. But know that there are 7 of the 8, I won't speak for MD1, but 7 of the 8 are like rowing together. We're all trying in the federal delegation to cross leverage. We're working with our 2 senators. We're working with the governor, who wants no one left behind. And we are really blessed to be in this state, but also to set an example for all those across the country. I am trying. My big thing is, I keep saying, it's not make America great. These things are making America break. And truly, they want to make America break. I mean, there is a whole, you can read the Project 2025 and what have you, and the Heritage and what have you, but these cuts are actually breaking our agencies, breaking our public trust in what we can do, breaking our public faith in our media, breaking our ability to function. And really, the saddest part is instilling a sense of fear. Everyone's and it's one agency, one law firm, one at a time. But as you do that, it really starts to break apart what our pillars of government and our balance of power is. And we're not going to let them do it. And so the most important thing we can do is actually, on a local level, come together and build back up. And that is how we're able to sit there and say, we're not going to break. We're going to keep going. We're going to be neighbor to neighbor. And then on a federal level, I am working arm in arm with so many of my colleagues to push back and change the narrative nationally. So a lot to be said. I'm not sure if there's questions, but I just want you to know that we are all working in lockstep. We are all fighting. We are showing up every day. And it is something, I think Mark Decano, one of our reps from California, said we are going to show up, speak up, stand up, and we're going to fight for the things which we believe will for the best interests of those that we serve. So thank you, Mark. Thank you, so many of you on. Know that my office is open. I have resources on my webpage. We've already had 170,000 people reach out for help since the beginning, since I swore in on January 3rd, a multifold increase. Yay, Sunny Holding and Sarah and all of my staff. But we are meeting the moment as much as we can. We have a lot of information about resources and what agencies are still functioning or not. And we're in the fight. So thank you.
Thank you so much for joining me today. Thank you for setting this whole event up today. I kind of understand how you feel about, how we have to face people, because it's hard. And, we're trying to do everything we can do. And I think we also know that at the end of the day, there are limits on how much we're going to be doing. It's hard to replace.
With resources, right? I mean,
Yep.
as I said, it's the triaging because they're trying to, oh, we're not cutting healthcare, but then they're pushing all of those costs onto the states, which have this other tsunami of cuts that they're also facing.
Well, hopefully the states will respond by helping those people who benefited from the tax burden so that they could shift the burden to the state, those billionaires. It would make sense that since Mr. Trump would like them to pay locally, that we assist them in paying locally. This should not be dumped on average Marylanders. This should be put on the backs of the people who lobbied and got the tax cuts they wanted, on the logic that the states would pick it up. So if we pick it up, it has a cost.
It has a cost, and sadly then, and why we don't want us to pick it up, because the sad but realistic part is, you're right, it has to be paid somewhere, and we have to have a social net, and we have to care for those who are most vulnerable. And by the way, this was not a clean CR that they gave us, and they're playing,
Yep.
And they're playing with a lot of misinformation. But the what you have to weave, and I'm just going to put it out there, having worked in for-profit, having had a husband who started 2 companies, the problem we have is that when we are, as a state, we can only, or as a county, put so many taxes on our businesses and our people before they say, I'm going somewhere else, either West Virginia or Virginia, because so many of my Western Maryland counties are having that flex over across the border. And so it's really not fair to impose that upon our states and our counties, because that is, in essence, a way that might push more investment away from us, as opposed to what I would like to do is to bring more business and investment and good paying jobs into Maryland. So threading that needle is hard. And I'm so damn mad because this administration, Maryland's got a bullseye on its back. They're coming after our agencies,
Yes.
they're coming after our governor, they're coming after our programs, they're shutting Greenbelt for the USDA facility. And so it's important that we do push back, because these cuts cannot be shouldered by the states, and nor should Montgomery County have to shoulder them more, because although we must, when we have to, we're going to have to figure out a way by which to be creative.
I'm not volunteering for punishment, but at the end of the day, if I've got to house people or we've got to treat people,
I totally get you. I totally hear you, and I agree with you. It's just, I totally hear you and support that. It's just, it's going to be it's such a difficult predicament for our state
Yes.
and for our counties. And as I said, I'm trying to find the common sense in any of this, and there's not a lot around. But anyway, that is kind of my prism. I think that I take one day at a time. But we do have a really good delegation.
And I think as I said before, we left the fiscal year in pretty good shape. So we're going into at least this part of the year with some buffer. I don't think it's enough to absorb everything that could possibly land on us, but it's better than looking and immediately saying that they did this, now I immediately have to respond with a cut. We think we've got some room left to do some work.
Particularly during the shutdown.
And then we'll see what the impact is. How many jobs are lost will determine how it affects our tax revenue, and that will affect our ability to do things next year. And that's, the danger of disinvestment is that also drives people away. It's like if you don't invest in your schools and people get a sense that you're not performing, or if, Maryland ranks 37th in transportation, Virginia ranks 3rd. If we shy away from investments in transportation, then we may protect tax rate, but we may shoot ourselves in the foot by continuing to not be competitive. So you're right. There are things we have to thread, but we've got to figure out a path forward. I know.
Well, investment is really, I think if you look at businesses, they want investment in infrastructure. investment
Yep.
in obviously broadband, and they want a well-equipped workforce, right? And when
Yep.
you've got those, you have that talent. I will lift up, and I'm not just being complimentary for complimentary sake. I really believe it. This regional service center is, and all of the other members of Congress that came from, Nevada and, different
California.
California, different places across this country. And, some had more rural places, some had more urban places. But, having a one-stop shop for all those who want to seek out, food
Yep.
assistance, housing assistance, Medicaid, Medicare, maternal health, a dental, site. I mean, it is an incredible, and of course, the Up County Hub in terms of food security is an incredible resource. But you know what? It saves money.
Yep.
Because when you invest in that, when you invest in making sure that people aren't evicted, when you invest in their health, when you have preventative health, people are not overwhelming your emergency rooms, right? And so I think getting out that narrative of not only of what you are, how you invest, and how those preventative and
Yep.
well-being measures actually pay dividends. Head Start changes the
Oh,
trajectory
yeah.
of our children, right?
Head Start is the single most important investment you could possibly make in schools. Um, no offense to the blueprint, of which Head Start's a part, but Head Start, of all the things in the blueprint, is the one thing that is the biggest game changer. If kids
Huge.
get early childhood and they start school on grade level, they stay on grade level. It's a pretty simple equation. So I continue to hope that in a time of limited resources, everybody prioritizes and puts money into things that are the most effective things to do. Just a plug for thinking about how we deal with
No,
scarcity.
I agree. I have been working on some options with affordable daycare, and I've been also working a lot on rural economic development because I have so many of our rural counties as well. But Head Start is far and away, heads up. Yeah, you're right. One of the best ways that we can invest in the future. So the other thing I would say is that it's really important that we continue to have our agencies funded. I have
Yep.
NIST and
Yep.
NIH, Institute on Cancer. I don't know if you follow me on social, but someone dropped off, a constituent dropped off a T-shirt the other day, and it said, "You think research is expensive? Try disease." And, right? But it's like, think about, and, when you
Yep.
think about what's coming out of the CDC right now and just this lack, of, and the sad part is, some of these misconceptions and misinformation, and, take they take wind, and what's so weird is that we are undercutting, and maybe they are intentionally doing it across the aisle, any of the independent research organizations, validations, reports about how markets do, and then they put out this information. And I have to tell you, I have a daughter who's a lawyer, 28, very well educated. And she said to me the other day, "Mom, can I take Tylenol? I don't think I can take Tylenol. Is there something
Oh,
with
wow.
Tylenol?" And I was like, "Oh my Lord." I said, "Brooke, you are a lawyer. Oh my God, what are you talking about?" But it just, these things, and then she said, "Oh yeah, you're right. That's silly." But what happens, I think, is that when you start saying this stuff and
Oh,
then
yeah.
spouting it, and then you don't have something on the other side to counteract it, it's kind of frightening, right?
He sucks up all the opposite, all the oxygen in the room with this stuff. I mean, it's really alarming. But my view, when when you knew they were going after NIH, I just went on the NIH homepage, and they talked about what they did, and I kind of saw there why they're going after NIH, because it's hard to be against finding treatments for diseases. They find a way, but the purpose of a lot of the research was finding causes. A lot of the causes are environmental, and they don't want to find those causes. I mean, the fact that with the Clean Air Act, They're getting rid of the finding that found that dirty air, polluted air is unhealthy. It's like, if you discover a cause, then you have an obligation to fix the cause. And so if you don't do any research, you don't discover any causes. If you shut that stuff down, then you can't say you need to protect us from this chemical. You need to protect the climate because higher temperatures are going to, cause more viruses to expand into places that they don't currently exist. It's like they do not want us to have reasons for regulation. And it's not a good reason
And
to
control the narrative. They want to
Yep.
control the narrative. It's also independent reports,
Yep.
Rewriting, numbers. And even the weirdest thing is, they talk about efficiency and effectiveness, but even, our IGs and, some of the
Yes.
reviews that we have to make sure that, money is well spent. They don't want to have any of those, oversight functions, God forbid, because there would actually be oversight of what they're doing, right?
That would be a terrible thing.
And, well, not really.
I know.
But it's, and listen, I say this a lot, I am common sense. I'm a common sense kind of person. It comes from growing up in Idaho. I say what I mean what I say, and what have you. There probably are parts and programs, maybe started during the Cold War, God forbid, that are outdated. I mean,
Yep.
there are things that perhaps are redundant. There could be more efficiencies. And in fact, sometimes to invest in new areas, you have to kind of reimagine them from other areas. But you can't do it in 2 months through an AI algorithm with Doge going in and a chainsaw. And I think that is the hardest part, is that I don't think it was ever about efficiency or effectiveness. I actually think it was more about fear and having everyone not know what was going to happen, which is, to me, even more upsetting, because
Yep.
maybe it's just me, but I think we as Democrats want to do the right thing. We want to tell the truth. We want to uplift. We want to say, and unfortunately, I'm not saying all Republicans. I have as many friends on the right as on the left, but I think that some of those that are in these positions, deliberately, obviate some of the truth, and that's
Yep.
hard, right?
Mr. County Executive
Yep.
and Congresswoman Delaney, McLean Delaney, we have a couple of members of the media on this call.
Yep.
Sure.
Let's see if they have questions. And Mr. County Executive, to remember that you have a 3
Sure.
p.m. meeting back at the EOE, so that you need to transport yourself. Members of the media, any questions for the Congresswoman right now? Please raise your hands. No questions? Okay, you can continue your chat, Congresswoman.
No, or if they put them in the chat, I don't know, maybe there's others that want to put questions in the chat.
Hold on just a second. Hold on just a second. I see Judith Hers there with her hand up. She is from the Greater Olney News. Good afternoon, Judith.
Hey,
Good
Judy.
afternoon. Hi. Congresswoman, bear with me while I explain the story to you for a moment. I
Sure.
happen to be in York County, Pennsylvania, taking care of family right now. And there's a big media blitz on the local television stations reminding viewers that Representative Scott Perry has voted for all of these things that are going to happen to them when and if
What things are going to happen to them? I'm not quite sure what you're saying.
meaning that the challenge with healthcare and losing their jobs, perhaps, because there's a fair amount of people in York County who pop over the Maryland border.
Yeah,
and
they
go
do.
into D.C. and work and et cetera, et cetera. So all the things that we've just talked about today.
Mhm.
So and this ad has been playing over and over and over again.
So the ad is saying that the things that we are saying as Democrats are correct and they are going to happen?
Yes,
Or
that's
they're-
correct. They're
Mhm.
saying, remember, everybody, Representative Scott Perry is for these things, these negative things that will happen to you.
It's
So,
interesting who's doing that. It must be, yeah.
Yes, and I don't know because, quite frankly, I've never really been right in front of the TV to be able to listen close enough or
Right.
whatever. But my point is, when I was outside one day, a very staunch Republican neighbor of my parents came over to me and said, "Oh, I see the media," and he blamed the ad on the media. "The media is really out there, lying again to the people about, the Republicans and what they're doing. And, the Republicans have nothing to do with that." So my question is, do your constituents, your Republican constituents in particular, understand that what the people they voted into office are intending or hoping to do?
Great question. And I could go on and on about this. One, I think that there is a tremendous amount of misinformation that is coming through. I talked about Tylenol, but there is, on the HUD website, the House and Urban Development government paid for agency website. I'm not sure if you saw, they said, these left Democrats with the far left with 1.5 trillion, they want in cuts, blah, 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 went off on us on a political note, pushing back from the administration, which to me is unheard of, that you would use, have such political propaganda on a national agency website. But it just shows the point by which the other side will misconstrue facts, will put forth a narrative which can be a complete lie, but they will hold it up, and look at, look at our current, look at the CDC and Secretary Kennedy, and we know that there's not a lot of research going on there. So there is one, I think that people don't know what to believe. I think that they don't know where to get trustworthy news. I think that they have been conditioned that the press is not telling them the truth. And actually, as a broadcast attorney, where I started, they say that some of the last bastions of believed in media are our local news, local, television news, and our local papers, or people that you personally know, who you trust and respect. With respect to what's happening, and this is obviously on the local news, they're trying to influence that this is going to happen. The administration has a couple things that I think are going to hit them right square in the face. One, coming in the next week, a lot of people are going to get premium notice increases of up to 50, 100, 150%. And they're going to say, what the heck is this? And they might even have a few spicy words to say with it. Two, they're going to see that there are going to be less providers, not only doctors and nurses and different healthcare providers, but rural hospitals and clinics that are going to be either shuttering or literally, not providing essential services. But it's also, if you think about it, this administration campaigned on lowering costs, right? And they were going to, somehow, solve, Israel and the Gaza conflict, and they were going to solve Ukraine. Well, they haven't done either of those, although God knows there's been a lot of activity there. But also, most importantly, we've seen with these red light, green light tariffs that are, prices have gone through the roof, that they are, and they're seeing none of the things happen that would happen. And they're also seeing a lot of things they don't like. They don't like these immigration raids. They don't like Jimmy Kimmel censored. And so I think you're going to find more and more Republicans starting to scratch their heads. And it's up to us to spin the right narrative as to I keep on putting forth what is happening and trying to connect the dots. So that's a longer response, but in essence, I do think Republicans are starting to see it. Not everyone. If you go on my social, there are many, many people who have spewed a lot of hate for me in Western Maryland, but you are starting to see it. And I'll tell you, I keep showing up in Allegheny and Garrett. I'm there all the time. I fight for them and I say, listen, I'm fighting for all of you. I'm fighting for your communities. I'm fighting for that fire truck, that is in Allegheny County. I'm fighting for your FEMA aid. And I'm fighting for you farmers, and they're slowly starting to actually reach out to me and trust me. They say, you know what, Congresswoman, you show up and you keep showing up and you're trying to help. And, I think, listen, many people are never going to vote for me as a Democrat, but but some are starting to change their tune. And so I think, all we can keep doing is saying the truth, but also sharing our stories. Thanks. I think, Judith, that's a great question. And we all have a part of it. I keep saying it's not just me. It's not just me fighting back. It's all of us, all of our neighbors, and actually not getting on social media and having that discussion. It's so, so important. And I'm sure Mike has a lot to say too.
Thank you very much.
Thank you. Members of the media, any additional questions regarding this topic this afternoon for the Congresswoman and or the county executive? No more questions? Well, Representative McLean Delaney, thank you so much for joining us this afternoon.
Can I say just one quick thing?
Go ahead.
I would say that people keep saying, why are we Democrats? And why aren't we communicating better? And why have we lost certain segments that used to be with us? And I think there's a couple things. We're 1,000 flowers blooming. We have a lot of beautiful issues, what we have. But I think it's really important for us. I mean, if all of us, I would never want to be in a country where everyone looked like me, thought like me, or worshiped like me, because that's not America. But if we're Americans, if we love America, we have to love our fellow Americans. And I say that to Republicans and Democrats across the six. And I say that, we each have to say, what is it? I get really upset for anyone to say they have a hold on values. And I think the most important is the values to me are everyone has access to opportunity, to inclusion, and to dignity. And that, there is a citizenship that we need to reinvigorate. And it might have to be on a local level, but we have to, again, in this age of social media, start to, and I've said it for years, but we've got to figure out, for me as a Democrat, to say, what are my values and who are we? And I think that means being able to listen and to hear, but to stand up for what is good and true, and that we are, I think, not having the right discussions across our country as to what we want to achieve and who we want to be. And when we are able as Democrats, for me, and this is, I'm sure this is skews one way or another on Mark's channel, but, for the media and what have you, I think that it is in that marketplace of ideas that we are starting to lose. How do we define the values of who we want to be as Americans and who we want to be as a people? And I think that is the greatest challenge we have in the years ahead, because America has been the shining beacon of the world. And I don't want us to lose who we are and what we can be. And I can't believe I am here right now as a freshman member of Congress. I wasn't quite looking for it, but I'm glad that I'm both old enough and young enough. I guess I'm Gen X. To try and work towards that and try and work. But I'm really lucky to have the local leaders and the delegation that I have in Maryland to try and see how that works. So thank you. And thank you, Mark, for letting me be on this conversation.
Look, I really appreciate it. I mean, I think it's important for people to hear and have an actual calm discussion about this. I mean, I think we're all, I think, about the same thing. I don't recognize the kind of values that people are espousing should
I don't
be
either.
national values. I don't, I'm struck by watching them wrap themselves in Christianity. And this is a guy who's like, I'm going to arrest you if you house the homeless. I'm going to arrest you if you're feeding the hungry, and and you shouldn't give them medical care. And I'm thinking, like, okay, tell me where exactly in the Bible did housing the homeless, feeding the hungry, and not caring for the sick, where exactly was that said as the tenets of this religion? I feel like they've hijacked religion on top of everything else.
Yeah.
And are claiming to espouse these values, and everything they do is counter to what they claim their values are. And it's just disturbing. And you're right to talk about media, social media, where anything becomes true if you can say it and have it echoed, and you can certainly create the mechanism for echoing things. It is disturbing what's happened to our discourse, and it's hard
the
because
implication of AI as well.
yeah.
Right?
And we had, I've been involved in stuff in Montgomery County for a long time. We had Republicans sometimes who were better than the Democrats that we had. That was the reality. We had some really good people, and Republicans were not extreme. It wasn't like you might have debated the amount of a tax increase, you might have debated the cost of the program, but you didn't debate whether you should be helping people. Nobody, I recall, was like, no, we should just let them starve. Or, if they can't get medical care, that's not my problem. It's like, that's not the way this used to be.
No, it's not the public interest or why we are in government, but there is a villainization. And
Yep.
I guess that goes back. And indirectly, I guess that is what I was trying to say, is a discussion of values of who we are and who we want to be, and how we. And it's not just about religion. It's really about the core values of being one another's, keeper, and of truth. All right. And so it is something that I'm going to work on. I really am a communications major, as you know, but that is my number one thing that I really want to figure out how we can bridge this horrific divide, which has been capitalized upon and thrown gas on the fire by this current administration. Yeah. So I just had to say that, Lorna.
We've got work to do.
Yes, we do. But you know what? You can't give up.
Nope.
Can't give up.
I tell people I went to my first march in 1961. So I've been marching for 64 years. So like, you do what you need to do, right?
Yep, we sure do. Well, this was great. I mean, I look forward to further conversations, and just know that probably I will be doing a town hall on the shutdown. When is that? Do we know what day that is? I don't know. We don't, but I think we are working on one. So we will be having a town hall here in Montgomery or Frederick on the shutdown sometime in the next week or so. And additional resources are always on my website, and my office is always open. So look forward to hearing from many of you. If you email me, I do answer my emails.
Well, thank you. Thank you.
Thanks.
Thank you.
Thank you so much for joining us today. And if you need to depart, please feel free to do so. If not, you can remain on the call. Mr. County Executive, I believe you have a couple more topics to address.
I have one more thing I want to talk about. Another thing in the news today was that among the many new state laws that we discussed last week, as an expansion of speed camera traffic enforcement, we had a well-attended press conference about the expanded enforcement yesterday in Wheaton. But one law that we didn't highlight is one that's very important to me. It's Eric's ID law. It's a landmark piece of legislation. It was rooted in fairness, dignity, and public safety. We know that disabilities are not always visible. Physical, mental, and neurological conditions can be hidden, yet the need for understanding and respect is always there. And for too long, people with invisible disabilities have faced misunderstandings and unsafe interactions with law enforcement. Law enforcement officers sometimes have confused non-compliant behavior or belligerent behavior with a person's with attitude or with a person being hostile, and not always recognizing that some people who are neuro different, that they don't always function the same way, and things that that they're doing are not hostile and they're not meant to be belligerent, and they may be difficult, even difficult to communicate with in some circumstances. That's not resistance. And so the result of that has occasionally been, really sad interactions with police that result in deaths, other interactions that result in, severe punishment or, very strong physical intervention. And this new law, Eric's ID law, is a piece of legislation meant to address that. Physical, mental, neurological conditions can be hidden, but the need for understanding is always there. And not understanding that is a problem. So Eric's ID's law gives Maryland residents with non-apparent disabilities the voluntary option to include a discrete notation on their driver's license or ID card. I have to stress that this is voluntary. You don't have to put it on there. But it's, no one has to do this, but if you choose to, you can get your driver's license or your ID with a special symbol on it, and that symbol gives the law enforcement or a first responder the information they need to approach these situations with greater care and with empathy. For residents with intellectual or developmental disabilities, this notation will be in the form of a butterfly, and you can see in the screenshot there the picture of a butterfly that's going to be on a license or an ID, so that if you do have an encounter with a police officer and they ask for your ID and you give them the ID, it will let the officer know that this person needs to be taken care of with greater care and empathy in those situations. So ultimately, this is about equity and making sure that people with disabilities are seen, heard, and treated with dignity that they deserve, just like everyone else. In Montgomery County, we've worked to promote inclusion through parallel efforts like the Blue Envelope Initiative with Pathfinders for Autism and the Hidden Disabilities Sunflower Campaign. Eric's ID law reminds us social justice means creating systems that work for everyone. I want to thank the legislative and community champions who helped pass this bill, including Delegate Janelle Wilkins and Kim Taylor. And most importantly, we recognize the leadership and advocacy of Eric Carpenter Grantham and his mother, Linda Carpenter Grantham. It was courageous, and it was the persistence by Eric and Linda that gave life to this law. And their work ensures that many others will have safer, more respectful interactions. The initiative is vital to emphasizing our commitment to disability rights, community safety, and social equity. So I want to thank you for helping build a Maryland that is fairer, safer, and more inclusive for everybody. And so that is it for today. If you have questions, I can take them now. Or we can go to I'll let my health team, if they have any comments, go before the questions, I guess.
Thank you, Mr. County Executive. I'll keep it very brief today. Just a reminder, last year was one of the worst flu seasons we've had in many, many years across the U.S. and Maryland. And this is the perfect time to go get your flu shot. Having a mild case of flu is much better than being hospitalized or worse. So please go out and get a flu shot. It's also the time of year to get an RSV shot if you're eligible. Unlike flu, unlike COVID, RSV is a one-time shot right now. It's relatively new. If you're a senior or if you are pregnant or recently given birth, please please talk to your pediatrician if you're in the latter. If you're a senior, talk to your family doctor about the shots you should get. These shots are covered by insurance. They're available at pharmacies through providers. If you don't have insurance, please call us at the local health department. Our number is 240-777-1050. I'm sorry. We don't have COVID shots yet, but we do have flu shots for those who don't have insurance. Thank you for the opportunity to share that.
Thank you.
Thank you, Mr. O'Donnell. Dr. Stoddard, do you have any remarks today?
No, let's just take questions, I think.
Okay. Members of the media, if you have any questions for the county executive and the rest of the county officials, please raise your hands. Nina Hidalgo from the Baltimore Banner. Nina, you had a question? I saw your hand briefly go up. Okay, go ahead.
Hi, I had a question about something that we did not go over today and was told that this might be a good time to ask. Would that be all right? It's about the cancellation of the Hispanic Heritage Festival.
Yeah, that's old news.
Yeah, well, I bring this up because yesterday at a press briefing, Ginny and I talked to Councilmember Fanny Gonzalez, who had said that she was not aware of the decision to cancel the festival. And I wanted to ask what about this decision, why that wasn't communicated with council members in particular.
My staff says it was communicated to council members, maybe not in the formation of the decision, but in making the decision. And the decision was made because of our folks who work with the community groups and the feeling among the community groups that it would be best not to do that and to replace it with other activities that would take place in schools and other places in the community with less visibility. Obviously, there's real concern in the community about large public events that were prime targets for ICE raids. And my staff honored the opinion of those who were the community representatives that they felt safer to not do that event and then to substitute the alternative events we're doing, which is, you know, a nice way of saying we're continuing to celebrate the month, but we're going to celebrate in different ways.
Right. Yeah. Was there a direct security threat? Is that why the event was
No, there wasn't a direct security threat. I think, you know, ICE activities still occur in the county. And the concern was bringing lots of people together who would likely be targets, and what would happen if you did that and ICE decided this is a good place to raid. Because they're obviously not picking up just criminals. They're picking up people who have no criminal records. So we didn't want, and I think community leaders didn't want to present an opportunity where a large number of people could come together and wind up being subject to ICE. There was an earlier event in the summer that was one of the largest festivals that we normally have at the fairgrounds, and the holders of that event canceled that event out of fear. So it's a real fear.
right?
We tried to honor the community.
Has the county looked at options to have a level of increased security without actually having to cancel the event?
No, we can't provide security. I mean, there's nothing we could do. If I showed up, there's not a thing we could do to prevent them from entering a public grounds, whether if it was held at a park or it was a street festival. We have no ability to provide security. And that's one of the things that we have to tell people. We can't pretend that we're going to be able to put our police between the police and the people they're trying to deport. And so, you know, we've been very careful not to create an illusion that we can do that.
Right. Yeah, thank you.
Okay.
Thank you, Nina. Members of the media, any more questions this afternoon? All right, thank you for joining us. Have a great afternoon. Stay safe, and we'll see you next time. Bye-bye.
Thank you.